For this project, I will be looking at the effect that enucleation, or the total removal of an eye, had on the personal life of Dr. Rudolph Mattis, a famous surgeon from New Orleans. Dr. Mattis lost his right eye in 1908 at the age of 48 as a result of an infection of gonococcal conjunctivitis that occurred after operating on a patient with gonorrhea. After about 3 months of trying to cure the infection, the right eye was enucleated to save the sight of the left. A glass eye was made, and Mattis used a prosthesis in his eye socket for the remainder of his life. The condition of the sudden total loss of vision, as Mattis experienced with this enucleation, is called acquired monocular vision. In the early part of the 20th century, when Mattis lost his eye, there was not much research looking past the cosmetic effects and the economic effects of eye loss, such as loss of employment based on the physical disability. What was known at the time is that monocular vision tended to lack the depth perception of binocular, or two-eyed vision, and that individuals with monocular vision experienced a loss of the visual field. Nowadays, research is looking at the effects that acquired monocular vision has on individuals, such as difficulties performing everyday tasks, including reading, pouring liquids, driving, and social activities, and the depression that often accompanies the loss of vision. Based on the current research literature, the effect acquired monocular vision has on individuals is just starting to be explored in more depth. Because of this, there is still a rudimentary understanding of how, and in some cases if, acquired monocular vision changes the course of a person's life and affects their ability to function in everyday life. In this case, Mattis returned to performing surgery quickly, less than 2 months after his eye was removed, and continued on to have a prolific surgical career. However, Mattis was also known to be very sensitive about the loss of his eye. This research aims to explore what, if any, changes occurred in Mattis' social life and hobbies as a result of the enucleation of his eye. To determine what effects the enucleation had on Mattis' personal life, research will be undertaken in the Mattis collection at the archives of the Louisiana Research Center at Tulane University. The collection contains many items documenting Mattis' life, including correspondence and personal notebooks that may give evidence to understand the changes Mattis underwent after this procedure and the effects this had on Mattis' personal life. At this point, collections of Mattis' close acquaintances are also being evaluated to determine if they are applicable to this research. This research will help highlight a side of Dr. Mattis that is often ignored. While professional accomplishments, especially ones that radically improve the healthcare system, should be celebrated and discussed, it is important to remember that life is also made up of private moments. Understanding the effects Mattis' eye loss had on his personal life will help us to understand Dr. Mattis as a whole person, not just as a surgeon.